Who's going to start first?
Okay, I have here Dr. Christian Middleton. He's originally from Norway, and he's a chiropractor, nutritionist, and national board certified health and wellness coach focusing on weight loss.
Yes. And I have heard Dr. Jain. He is a cosmetic surgeon based in Woodland Hills. He's a master of his craft in body contouring, high definition liposuction, and fat transfer for gluteal breast augmentation and anti-aging fat transfer to the face.
Thank you, Christian.
Thank
Christian,
you.
it's lovely to have you here. We are talking here about a lot of things that Dr. Middleton does for his weight loss, and I want to start with asking him, Christian, why did you become a weight loss coach?
So, I was I'm still am a chiropractor, but it was a chiropractic patient that came into me, and she was about 100 pounds overweight, and she was, like many of us are, she was a little slightly hypochondriac in the sense she had high blood pressure. She did. And she was on 3 different kinds of blood pressure medication, and it still wasn't really controlled. It was high. And she truly lived in the fear that she was going to die any day. So she saw I had started with a little bit of a weight loss program at the time. And she asked me if she lost weight, would it affect her blood pressure? And at the time, I didn't know as much as I know now, but I still, from what I knew, is chances were that if she lost about the 100 pounds she needed to lose, that most likely would have a positive effect on her blood pressure. So I put her in an 8-week program, and she dropped about 35 pounds. And then she went to her doctor before coming in for the last visit with me. And he was quite astounded by the difference and asked her, "What did you do?" And she was embarrassed about talking about it being a diet. So she said, "I've been doing some exercises." And then the doctor sits her down and tells her basically that, well, you have to keep doing these exercises for the rest of your life, because as of right now, your blood pressure is normal and you can come off your medication. It was pretty drastic. So she relays this same story to me in my office and hugs me in tears. And that was a little bit of an aha moment, because I've been helping people get out of back pain and neck pain for a long time, but I'd never had anyone be so grateful. And I sort of realized how impactful it is on a person's life when they lose weight. And so since then, I'm obsessed about it and gotten degrees in nutrition and weight loss and obesity. And yeah, I love what I do. Your sound.
Sorry, we'll crop it.
Yeah.
So I was just protecting the video from the background noise. But
Yeah.
So that's great. That's great to hear. One of the other things and that you say in your journey to become a weight loss coach, more technically, how does weight loss affect health beyond aesthetics?
Yeah. So like I mentioned, it's so impactful when someone lose weight and get to a healthy weight. And it pretty much affects every aspect of a person's life. And starting with something that many people don't necessarily think about so much, because we don't necessarily feel it or see it. But when you get into healthy weight from having been overweight, I mean, you drastically reduce your chances of any kind of heart disease, heart attack, stroke. You are generally able to lose your blood sugar levels, which reduces your chances of developing diabetes, which is so common today. And even if you've gotten an early stage diabetes, proper weight loss can help you reverse it. You reduce the chance of many common cancers. You reduce your chances of Alzheimer's. You reduce half of our populations walk around with some level of a fatty liver, so you're able to reverse that. You reduce your chances of developing chronic kidney disease. You can improve sex drive with it. You can improve fertility with it. You often improve the confidence. As you know, when someone likes the way they look, that has an indirect benefit for the health, because when you feel good about yourself, you'll tend to make better choices and be healthier, and the increased self-esteem and confidence improves the social life, which is also important for well-being. So it's on and on and on. And here's a funny little tidbit that a lot of people also don't know, is that when you drop 1 pound of weight, that decreases your impact load on your knees by 4 pounds. So a little quick math here. If you drop 10 pounds, which isn't that much, I have patients lose that in a week. You reduce your impact load on your knees by 40 pounds with each step. So if you do your recommended 10,000 steps a day, that's 400,000 pound decreased every day on your knees. And so, yeah, that's almost 500,000 pounds. And you don't have to understand too much about biology to understand how beneficial that is for your joints and reduce your chance of having to have knee replacements, for instance. So the list is on and on and on, and it's really all encompassing. There's very few things. I actually can only think of one downside of losing weight and maintaining it, is that sometimes some moments that you have been used to using food as a drug, and I mean that you use food as a comfort, for comfort, not because you're hungry, use food as a drug. You have to give up those moments and find a healthier way to switch your headspace. That's it. Everything else is positive.
That's great to know. So is it possible to lose weight fast and safely without medication?
Yeah. I mean, obviously it's safer without medication because there's no side effects, right? Some medication can come with side effects. So, and, you know, here's the thing. Our bodies are meant to burn fat for energy. It's not something strange. We have to force it to achieve something unnatural. In a natural environment, your body would be burning fat on and off all the time, right? So, but then how can you lose it quickly? Well, your body is only going to use stored fat when it has no other options. So how quick you want to use depends on how much you're feeding it from the outside on a daily basis. But if you do this efficiently and give yourself a proper calorie deficit, and you eat most advantageous times of the day, good structure, and you eat nutritious food that's high in fiber and protein, so you're able to protect your muscle mass and keep your metabolism up, you can lose weight really quick and really efficiently. Now, there are some depends, and all of this is assuming that you have a healthy metabolism. Hormones play a big part. So if you have a lot of insulin resistance, that can slow things down a bit. Granted, when you do something like be in a deficit for a while with healthy food, you can actually improve that, and it will improve when you do it long enough. But things like if you live with a lot of stress and you constantly have high cortisol levels, which will push more insulin, and if you live with constantly high insulin levels, it's very hard to burn fat for energy. That can obviously slow things down a bit. Or if your estrogen or thyroid levels are out of normal ranges. So for people to have quick, efficient results, I always recommend check all these hormones, that they're in a good place, in a healthy place. And yes, when they're in a healthy place and you kind of align your eating patterns with nature and how you're intended to eat from time to time, you can lose very quick. We have patients lose in a month 10 pounds up to, obviously, really large individuals. We've had people lose 30 pounds in a month. So it's pretty quick. And that quickness also makes it, easier to stick to because you're motivated. You see quick changes and it makes you want to keep going, type of thing. Yeah.
Okay. Moving along. What do you think are some of the more common challenges people face when they try to lose weight?
Well, there's a lot of them. It's our environment, it's so unnatural. There's so much temptation. You're swimming upstream, left and right. So there's a lot of challenges. The most common ones, one is just the fact that it's such a big issue in our culture, and there's so much information about it available. So if you're trying to do this on your own, just by Googling and reading and listening to everyone's opinion, it can be really confusing. There's so much information. On top of the fact that some of it is conflicting and some is straight out incorrect. So it's hard to maneuver. That's a challenge. Another challenge is just motivation. Like you're in an environment that is, you kind of have to swim upstream, and to swim upstream, you have to be very motivated about why you're changing and going kind of against the stream a little bit. And you can't just be motivated for, 3 days a week. You have to be consistently motivated. So, that's a lot what I work with my patients on, is to help them maintain that level of motivation, because that's key. So yeah, motivation is one. And then if you go through a phase where, this varies from person to person, but it's common. If you're going through a phase where you're trying to make these changes, and there's a lot of birthdays and weddings and holidays, and a lot of people find it challenging to maneuver through all of that and still, keep heading in the direction they plan to. So there's a lot of challenges. A lot of it actually relates to lack of understanding the body. So we focus a lot on education, because, for example, a very simple example, if someone stick to something, they're consistently going to burn a little bit of fat every day, but that may not be reflected on the scale. You could have lost a pound of fat and be up 2 pounds because you're holding 3 pounds of fluid. So these things can be challenging, especially if you are doing this on your own. We use a lot of tests, physical measurements and body composition tests. We can always show the patients from week to week that their efforts are paying off and they're really moving in the right directions, which excites them and makes them feel confident in the process, and helps them keep going. And we also use a little bit of some natural supplements to support a healthy metabolism and helps keep hunger at bay. So it's a little easier to do. Yeah.
All right. I'm actually running out of questions. So one of my last questions is, how do you help patients maintain weight after a procedure?
So after a procedure or having lost a lot of weight, I recommend for all my patients to do some form of accountability program, maintenance program. So we have a maintenance program, and the bottom line is the accountability helps a lot. So you can see from month to month, right after you've lost a lot of weight, you've followed some guidelines to get to that are different from how you normally live your life. And if you just go back to the habits you had, your automated behavior before this process of changing yourself, you'll regain the weight, basically. So you have to make some subtle modifications. So our program is a 1-year program, and every month we focus on a specific healthy behavior that it might be slightly different from what they did before when they gained weight. And it doesn't have to be that much. It could be a subtle change. And I introduce my patients to roughly one every month, a new one, 12 excellent lifestyle habits or behaviors that helps maintain weight. And they all have options within them. So they kind of get to try on what works for them, what works for their personality and their lifestyle. And then when they find something that clicks and they feel like, oh, I can do this, let's say it's a typical new type of activity or something, or a fasting window, intermittent form of fasting. And then they just do that repeatedly. So it becomes automated behavior, new habit. And that's key. And all along, they're kind of being handheld through the process. They're being held accountable while they're solidifying these new habits. And with that, in the later years, we've done that with patients. We have an 85% success rate in helping patients maintain weight, which is, compared to national stats on the subject of maintaining weight, extremely high.
That's great. That's great. I'm thrilled about what you do, and I'm pretty sure a lot of my patients who are looking into a more holistic approach and natural way of losing weight benefit from a consultation with you.
Yeah. So now I have some questions for you.
All right.
Yeah. So I know, a little bit of I know all the details of how you perform things, but I have an idea what you do. Who are the perfect candidates for liposuctions, and what areas can fat be transferred to?
So liposuction can be done on most patients. Ideally, the liposuction can be divided into more like a debulking the fat. And I want to tell the viewers that look, liposuction is not a procedure for weight loss. It's something to get into shape faster, quicker. So liposuction can be of two types. One is debulking, where a patient who has a BMI greater than 32, a lot of fat percentage in the body, they can debulk the fat, but I always tell them that you have to be in a weight loss program in order to get into a great shape. But a perfect candidate for me would be someone who is already on a weight loss program and is motivated to get into a great shape, comes for a liposuction. The BMI can be around 32, 35, or less than 32, but they will get into a great shape as long as they are on a weight loss program in conjunction with liposuction. Where the fat can be transferred to, that's a great question. We usually transfer fat to glutes, called BBL, or fat can be transferred to breasts. They can be transferred to hands. And lately, fat transfer to face is the most in thing. It remains permanent. You don't need fillers every year. And it's very anti-aging. It's almost a permanent effect.
So from what you're saying, I gather this would be perfect for some of my patients who, they've been very diligent. They've lost the bulk of all their weight, but they just have that little stubborn bump on the belly. This, I assume, would be an excellent candidate for this.
Right, stubborn fat can be removed with liposuction, and then depending on where they are in their weight loss program, how much they have lost or losing, or how motivated they are, they can start getting into better shape.
Yeah,
they desire.
Yeah. Okay, so I was wondering what is the difference between liposuction and high definition liposuction?
So this is catching up very quickly. So the liposuction is just removing the fat, maybe trying to get into some shape. But high definition is actually more etching, shaping the muscle, chiseled appearance. This is more like an athletic experience.
Right.
Or athletic look that a person wants. And for that, you have to be very motivated to be in a weight loss program. You must be aiming towards a normal BMI of 25 or 24. You can be in a high BMI and get a high definition liposuction, but the sharpest look that you're desiring will only come to you when you are continuously working towards a weight loss program.
Yeah, so it's a sculpt. So yeah, I mean, if you have a lot of muscle, then you could have a high BMI still and be in incredible shape.
Yes.
Yeah. Okay. So I also read there's a difference between awake liposuction, and why is that better than liposuction under general anesthesia?
Well, awake liposuction, just like it says, awake, you are awake all the time. You're
Yeah.
talking to the doctor. You are not put under general anesthesia. You're not put to sleep. You're interacting. I think that there is no reason for a liposuction to anybody to go under general anesthesia. One, it is highly costly. There's an anesthesiologist involved. You have to be in a center where they can handle general anesthesia. They have to intubate you, or some kind of an IV sedation, and much more monitoring is required because of all that. Of course, with that, it tends to shoot up the cost of the liposuction. And then with general anesthesia comes all the complications related to the general anesthesia. Other than that, there is much more bruising and swelling, and the recovery time is also longer under general anesthesia. So I never perform anything under general anesthesia. I tend to go with awake liposuction all the time for faster recovery, less complications, cheaper, much less bruising and swelling, for all those reasons.
Yeah, it doesn't sound like there would be any reason to use general anesthesia.
Right.
Okay, that's good. So how soon can patients see results after liposuction?
Well, any liposuction, people tend to see results in about 6 to 9 months. Again, if they are on a continuous weight loss program, even after the procedure, they will start seeing results much sooner. Most of my patients are very motivated. They are on weight loss programs, so they start seeing results right within the first month, and they keep on getting much better and better with each month passing.
Yeah, that makes a difference when people see results. They're more likely to stick to whatever regimen term. Yeah. So after liposuction, what is the most important part of the for the self-care after liposuction or body contouring?
It's best to follow all the recommendations of your doctor as to what you should be taking post procedure medications, when you should be moving around doing exercises, or how or when you should be going back to the gym. Those are very important things. Coming for follow-up visits on the recommended times by your doctor is very important. How you'll be resting the body if you have a fat transfer, or laying down or sitting, all those recommendations, any vitamin supplements given to you, or medications given to you post procedures, you have to follow very strict protocol given to you by the doctor who did the liposuction or body contouring on you. I would say weight loss again after the procedure is tremendously important for both patients who are not in under normal BMI or above normal BMI. So continuous weight loss program, looking after your diet, exercise is very important. One thing I must tell viewers that liposuction is only removing fat which is under the skin, but not the visceral fat. The visceral fat can only be removed with diet and exercise and being on a weight loss program.
That's a really good point. I think a lot of people don't think about that.
Yeah. So I think our viewers would definitely benefit from both having a consultation with you, Christian, or with me, depending on how confident they want to look into their skin and have a new shape or new body.
Yeah.
I think this was a great conversation between you and and I believe we are going to put this conversation on our social media channels, so for our viewers to watch and gain some insights into it.
Yeah, no, I think it's a great, and between the two of us, we can help people both become healthy, and if they need a little polishing to feel they really good about themselves, it's a great combination.
Okay, I look forward to having another conversation at some point, another show, another talk show, and do tune in with Aesthetic and Cosmetic Surgeons and with Dr. Christian Middleton. He's located in
Encino.
Encino, yes.
Yeah.
All righty, Christian. It was nice talking to you.
Likewise, it was a pleasure. Enjoy the rest of your day.
All right, bye-bye.
Take care. Bye-bye.